Hi, this is Brandon with ChiroUp. Today we're going to talk about the MD lunch. We've had a lot of questions concerning how do we do our medical lunches, and it doesn't matter if it's an OB or a dentist or a medical doctor. The lunches look very much the same, and it's all about speaking a common language. They have a certain set of diagnoses they have, and they have a certain number of patients with those diagnoses, and they have a need just as much as we have a want. So we have to make sure that we have two main objectives when we walk into a lunch. The first one is to recognize that this is their lunchtime, that you're building a relationship. You may have the best printouts and marketing pieces that you can buy on the market. However, the main point of this lunch is to build a relationship with that person, have them understand that you're a good person looking out for their patient's best interest. However, when it's time to make a pitch and it's time to market your services, you better have everything you need to make that pitch successful. What we use is a folder, and this folder has everything in it that is specific to that doctor to make their life easier. And in this folder I have a quick CV of myself. It just has a couple little things. It doesn't have everything that I do. It doesn't have everything that I've ever done. It just has the things that are pertinent to that doctor. But most importantly, they want to know what we do, they want to know why we do it, and then obviously most importantly, what are our outcomes. And as far as what we use as far as handouts, the first thing is that condition report. Is have a nice pretty color printout of what you tell your patients. Here's exactly what I tell your patients. Here's the rehabilitation exercise I give to them. Here's the patient education that I give to them. Make it very simple for that doctor to understand that what you're trying to accomplish with their patient. The second part is why you're doing what you're doing. And that's where the condition reference section comes important, because medical doctors look at the reviews, look at the peer-reviewed studies. Make sure you have evidence to back up everything you're saying and everything you're doing to that patient. And then most importantly, the reason we get 250 to 300 medical doctor visits or referrals per year is because of this one sheet. This one sheet right here tells a doctor exactly which conditions I treat, and it explains how many times I saw them, what % better are they, how satisfied are they with their care. And I can tell Dr. Smith, listen, when I saw cervicogenic headaches or lumbar spine disc lesions, I saw the patient average 6.4 times, they were this much better, and now they're back in your care. So using the My Clinical Profile in ChiroUp is going to build your practice for you. Also have in your hand, it doesn't have to be the same article, or it could be a new article. For example, the new JAMA article for spinal manipulation and lower back pain. But have a new study to say, hey, I keep up to date on the literature, and we're changing our practice protocols and paradigms based on the new literature to show that you're somebody who's keeping up with best practice information. If you are looking to market outcomes and not just market the services and techniques you do, using ChiroUp, using the best practice information, and using the My Clinical Profile section will do that for you. If you have any other questions, let us know. You can get more information at chiroup.com.